Katrina.
Hey, Miss Sally, how are you?
I'm great. How are you today?
Oh, I'm fantastic. Good to see you.
Likewise. What's new?
I was really excited to tell you actually. I hung out with a friend over the weekend and dinner time rolled around. She has a little guy, 4 years old, and dinner time rolled around and he started squirming and hiding under the table. And I asked her, does this happen often? And she told me, oh, yeah, all the time, every meal. Dinner is usually the hardest, but breakfast, lunch, and dinner are challenging. He had broccoli, chicken, and she brought out Chex Mix as his buffer to get him started. And I asked her how long it had been going on, and she said his whole life, ever since he was
Oh
2 months
my.
old. Yeah. And so it got me thinking, with all the continuing ed we've done and the things that we've learned, well, what started all of this? And she mentioned a complicated medical history. Um, but the crazy thing was, no doctors, she talked to pediatricians about the challenges and they were concerned about his weight gain, or his lack of weight gain, but no one had ever said, this is a feeding disorder. It stems from a complicated medical history. You're not the problem. This is a medical diagnosis and there's a solution. So when I talked to her about the fact that, this was a medical diagnosis and it wasn't her fault, she actually cried. And it got me thinking about how many parents there are out there who say, I can't even feed my kid. What am I doing wrong? And it just made me think about how often we hear that. Um, so talking to my friend, I wanted to talk to you about how often we have families who have no idea that it's not their parenting, but rather a true feeding disorder.
Doesn't it make you sad when
Absolutely.
parents feel that it's their fault, that somehow they're the root cause, and often they're not at all. I mean, parents are often so diligent, they're trying so hard, and yet their child is experiencing a pediatric feeding disorder, especially the kids with autism. The rates vary between 80 and 85%. I mean, that's how common it is.
Right. Right. And this kiddo, all signs point to he doesn't have autism, but he had this complicated situation in the hospital from 2 months old. So I'm curious too how often you see complicated, medical histories and, being on a feeding tube as a baby and how that trickles down throughout life.
Exactly, exactly. And I think that looking at the child's past history and experience with food, experience with apprehension and fear are so real, and they can be misread as behavior problems. So
Mm,
there are all kinds of reasons that kids avoid eating, and one is that they might choke on the food.
mhm.
So a lot of the kids that we end up seeing, right? I mean, we have about one third of our caseload to 40% has some type of pediatric feeding disorder. And the most common problem is that they get stuck on soft foods and soft textures and processed foods. And they're really easy to chew. And so the kids don't end up learning how to chew, and they don't learn how to use the big chewing muscle in the back. And so they stay with foods that are really easy to chew, that they can suck on or they can just swallow whole, like pouches and purees and yogurt and things like that. And next thing you know, the child is 4, 8, 12, 16 years
Mhm.
old,
Mhm.
and really stuck in this pattern. But if they tried to eat something that was denser, poor bunnies they just can't. I mean, physically they can't do it. So what they say is, I don't like it, it's gross, it's yuck, it's purple, it's whatever.
Mhm.
But because I can't articulate, they can't put into words, if I put that food in my mouth, I can't chew it, and I might choke.
Right. Absolutely. And I thinking about my friend and her little boy, it broke my heart to talk to her because she had no idea. And she was reaching out. She knew that it wasn't right and she was reaching out for help, but the professionals that she came in contact with, unfortunately, I think weren't experienced with pediatric feeding disorders. So, the language that they used was, it was about her parenting and what's going on at home, and
Wow.
they didn't give her the right kind of direction. So then it made me think, for the average parent whose professionals maybe aren't giving them direction, um, the kinds of things they can look for and pay attention to, like you're saying, with the textures and the avoidance behaviors and the language that they are using. What would you say to a parent who is concerned about the way that their child eats and how they could go about advocating for themselves and for their child with the pediatrician who says, well, he's average weight and he's on track on the growth chart? What could the parents maybe say to the pediatrician to make that clear, what their concerns are?
I want a referral to a feeding specialist. So I just happen to have a brochure for Feeding Matters, which is an awesome national nonprofit in Phoenix, Arizona, that was established by 4 frustrated moms.
Yeah.
Moms are the movers and the shakers of the world, and they get stuff done. So one mom had triplets, preemie triplets, and all 3 of them ended up on feeding tubes. And they didn't have autism, but they had other challenges. And the other 3 families did have children with autism. So these moms 10 years ago established this group, and anyone can go on the Feeding Matters website. It is loaded with great information and tips, and parents can take an online quiz, all free, and start figuring out how worried they should be on a scale of 1 to 10. I mean, how serious is it really? And also Feeding Matters has a parent-to-parent program. So if a family wants to reach out to another family, mom to mom, dad to dad, grandma to grandma, who's in sort of similar circumstances and geographically close-ish, they can do that. In fact, I was speaking with one of my parents yesterday, and she had just done that, and she said it was an enormous relief
Oh,
just
yeah.
talking with another mom of a 2.5-year-old who has a very limited diet. So I think things to look out for would be, what is the variety of the diet? So does the child enjoy foods from different food groups? Or is it a variety of leaf foods, root foods, protein-rich foods, fresh foods, baked foods, cooked foods, those kinds of things? Does it tend to be the same kinds of foods over and over and over again? Because if that's the case, nutritionally, the child really could be missing out on essential micronutrients. And those vitamins are really, really important. So when we get kids who only eat 5 things or 7 things, and it's those same things over and over and over again, the problem will not fix itself. The problem will not, the problem will not go away. We
Right.
had a patient who came in at 12 and in gifted and talented education.
Mhm.
So, but I only had eaten 7 foods for a decade.
Oh, wow. And it
A
was their normal.
That was his normal.
Yeah.
And they had been through counseling, and
Right.
they had been to see a psychiatrist, but the root cause of all this was that he never learned how to chew when he was a toddler and a young 2-year-old. And so his chewing pattern has stayed exactly the same.
Yeah.
And then all the other habits formed on top of it.
Hmm.
So going to restaurants, he took his own food. Family parties, holidays, birthdays, school lunches, staying overnight at a friend's house, all of that
Hmm.
family and social life there was a ripple effect, a negative ripple effect. And
Right.
parent stress was super high. And this mom was a rock star. All of we have so many rock star moms. Mom was a rock star, but those years of habit, the years of lack of change, the lack of the right kind of support. So problem A should get solution A and match, and there should be change pretty quickly. Like within a month or two, there should at least be small changes.
Mhm. So what would you say, since they had gone the counseling route and they were aware that this was problematic, what would you say was the tipping point that pushed them toward feeding therapy as opposed to a more cognitive approach?
Luckily, he happened to go to a child psychiatrist over by Trident Hospital who knew that we worked on feeding therapy here at our clinic.
Yeah,
And and she has sent quite a few adolescents and teenagers because that's her specialty age for the most part. So she knew where to refer.
nice.
Yeah. So lack of public awareness is super high. I'm on the board of directors of the International Association for Pediatric Feeding and Swallowing. I'm also the chair of the Public Awareness Committee because, in my heart of hearts, I know that this is time well spent in doing whatever we can as this multidisciplinary group to raise awareness of what is a mild concern, what is a small problem, and what is really a serious problem. And helping families advocate for themselves and raising awareness among early intervention professionals, parent support networks, certainly physicians, PAs, nurse practitioners, teachers, school districts. There's so much there's so much ground to be gained in all those areas.
Yeah. Well, and, I think a lot of people would classify or classify their younger kids as being picky because, a lot of toddlers don't want to eat this if it smells yucky, looks yucky. But I think what you said about really breaking it down and thinking about the variety, the color, the texture, the temperature, thinking about all of those different things, I think will help a lot of families to move from, oh yeah, he's just picky to, oh wait, he only really eats things from a really soft that are really soft in texture. I think that's a really great way to move from, oh, he's just picky to, we actually have a problem here and I need to investigate further.
Right, right. I absolutely agree. And when we do food intakes and food diaries with families, and I ask about how many foods does your child eat? Oh, about 15. Oh, what are they? Cheez-Its, Goldfish, Doritos, Cheetos,
Mhm.
peanut crackers, graham crackers. So it's really the same food,
Right. Yeah.
just in different shapes.
Yeah. Well, and it's just cool. It's great to think that there's a different way to think about it and approach it and be a little bit more analytical. And then the parents can kind of grab the reins and, like you were saying, advocate for themselves, especially when their kids are moving in a pretty normal fashion on the growth chart. We could dig deeper and think about nutrition and the whole diet and what's going on there. I think that's fantastic.
Yeah, yeah. Um, I would really like to talk more, but I've got an appointment, I've got to roll.
All righty. Well, thanks for squeezing me in. It was so great to talk to you and just
Likewise.
kind of refresh ourselves about feeding. Yeah.
There you go. There you go. I hope you have a glorious day.
Awesome. Thanks. You too.
All right. Bye.
Bye.